Hey everyone, it's Dr. Hodges, and today I wanted to talk a little bit about vitamins. I have a really good friend with me today. This is Carrie Johnson. She is with Bariatric Advantage. As a little disclaimer, this is not a sponsored video from Bariatric Advantage, but I have known Carrie, oh my gosh, we were literally just talking about this a long time. I did my residency at Baylor downtown. She's an RD, so she's a registered dietitian. And she was down there at the same time. And so when I say that we've worked together for a gazillion years, it's been a long time. But we're ladies, so we don't talk about age.
Right.
But with that being said, what I really want to try to do is a quick series, a couple of different videos talking about vitamins. And I'm really happy to have a dietitian with us. She is also a member of ASMBS, our Metabolic Society. So she's clearly very up to date on all your vitamin needs as a bariatric patient. However, if you are a patient that has not had weight loss surgery, there are still a number of things that you need to do if you are actively trying to lose weight and you're on any medical weight loss program, whether you're taking phentermine or Contrave or one of the GLP-1 injections. It's still really important that you're meeting all your vitamin needs, and we'll be able to discuss that today. Okay? Perfect. Because she also told me a couple of things that I wasn't aware of, and I've been doing this for a long time, and I'm like, oh dear. So this will be informative for me too. But the first thing I wanted to share with y'all is I have this card, and it is a vitamin follow-up. A lot of times I'll send this out to primary care doctors, or like whenever I'm going to meet them for the first time. And I will get this posted on my website, and I'll also have some links so that on my link tree and on my like to know, y'all will have this for what the vitamin needs are. And then underneath it, I'll have links to all the different vitamins that we're discussing today. Okay, so that they'll be nice and easy to find. So I think the first thing I would like to do is let's talk specifically about the vitamins that you need if you are a weight loss surgery patient. And then we'll do a series just on multivitamins. We'll do one on B12 and and we'll go on. But first and foremost, why do you need extra vitamins? When you are a weight loss surgery patient, you're either not getting enough in, or you're not able to absorb everything that you need. And that is why your needs are much higher. And also when you say, like with a brand like Bariatric Advantage, it's just a better quality of vitamin.
It is. It's specifically made for bariatric patients. And I will say it's been around for a long time.
Yes.
Back when I worked in bariatrics many years ago as a dietitian, it first launched. So it's been around for a long time with the first product out there. So yes, it's definitely formulated bioavailable forms that are easier for a bariatric patient to digest, and the levels, those higher levels that you need, like you said, you're just not able to get it from the food that you're eating alone.
Exactly. And one other benefit I will say, and clearly they know my patient population, all of these are very tasty vitamins. These are not crappy tasting vitamins. I mean, a lot of them taste like candy.
They do.
I mean, your probiotic and their iron, oh my God. Like if I take too much of your probiotic, it gives me gas and I have to use the bathroom.
Right.
If I take too much of the iron, it plugs me up. They taste so good. So I think that's the other thing is with these vitamins, they taste really, really good. So let's just jump right in. So if you are a bariatric patient, and this is whether you've had a sleeve bypass or duodenal switch, there are a number of things that when you're selecting your vitamin, you have to make sure that you're meeting these recommendations every day. So sleeve bypass, you need 60 to 80 grams of protein a day, and supplement duodenal switch or revision of your bypass, 100 to 120 grams of protein a day. You need B1, this is thiamine, and you need a minimum of 12 milligrams a day.
Really important one.
Yes. I mean,
Really, really important.
yes. What are some of the things, like if your B1 is low, your thiamine is low?
Well, I think, and correct me if I'm wrong, but the first thing you start to notice is some numbness and tingling in your fingers, right?
Yes.
So that can progress and even become irreversible down the road.
And the other is you can also begin to have some neurologic, additional neurologic symptoms. You can have certainly issues with cognition, Wernicke's encephalopathy. So it can really lead to much larger complications just from not having enough B1. You need your B12. That's 1,000 micrograms a day. Here's one thing that's key that I did not realize is, don't you need the B12 that kind of dissolves in your mouth? Not the one that kind of is where you swallow it and then it's digested and kind of processed through your liver.
So, actually, studies have shown that a high enough dose of an oral B12,
Okay.
meaning from a vitamin,
Uh-huh.
your body tends to learn to absorb it. So it doesn't necessarily have to be how we used to do the
Sublingual, like the drops.
sublingual, or you did the intramuscular injection, or they had the nose sprays.
Yes.
Right.
Mm-hmm.
They found that high enough dose orally through a vitamin can get you what you need.
Okay.
Yeah.
Because I had read some studies where they said, if you, let's say you're just taking a B complex that you get from the grocery store.
Right.
I remember reading at one point where they said you were only absorbing about 1% of that B12.
Well, and I think it's the form too, and just that
Okay.
bioavailability that you're getting too from a bariatric vitamin versus an over-the-counter vitamin even.
Okay. And when we say bioavailability, what we mean is how well is your body absorbing what you're taking in. So if something is very highly bioavailable, that means you're going to be absorbing like 90 to 100%, as opposed to 1%, which is, a waste of your money. Okay. So you need B12, you need folate, 400 to 800 micrograms a day, or 800 to 1,000 micrograms a day if you're a childbearing female. And, typically what I found is in a prenatal, you're going to have very high amounts of folate, which is what you need so that your baby doesn't have neural tube defects, which are congenital issues with spinal cord and brain formation. What's unfortunate is with a typical prenatal, they're going to have a bunch of folate, but you're not going to have everything else that you need.
Right.
So that's a problem. You need calcium, so 1,000 to 1,500 milligrams a day. Now, one of the things I've also found is calcium must be a great big molecule, because it doesn't seem that any of these will have enough calcium.
Correct. So first thing is, we don't put calcium in our vitamin. There is a trace amount in there, but we don't put all of that calcium, the 12 to 1,500 milligrams a day, in the vitamin, because iron and calcium compete for absorption, first of all, right, when we take them together. But yes, calcium is a very, very large molecule. So you've probably found if you do a calcium tablet.
Oh my God, they're huge.
Yes. Typically, they're too big to swallow if they're actually going to put like 500 milligrams in it. Most of the time, you see them with 300 or less. So you end up having to take several of them a day.
Right.
So yes, very large molecule. And we'll probably talk later about the calcium chewy bites. But our calcium chewy bites, it's a different form.
Mm-hmm.
So they're able to put 500 in one of the chewy bites versus in a tablet where it would be 200 maybe, and you'd have to take at least 6 of those a day.
Right. And this is what I always tell my patients. If you can find something that tastes good, that it's like the least amount that you have to do, and it is, cost effective, then you will be compliant. But if my patients are having to like set alarms, and you're taking 3 or 4 pills, 5, 6, 7 pills, you come to me to have weight loss surgery so you can get off of your 8,000 pills.
Exactly.
You don't want to trade that for like vitamins. So if you can find some good all-in-ones or a really good quality vitamin, it makes a huge difference.
Well, and I think too, talking about that, the benefit of a bariatric vitamin over the counter, because then you have to take, I don't know, a Centrum, then you have to take a B complex and a vitamin D and an iron.
Oh no, you can't just take Centrum, because there's 8,000 different Centrums.
Yeah, exactly.
And so if you do Centrum, the only one is like the old school Centrum Adult, but that's still not enough.
Doesn't have everything.
No, you have to do at least 2 of those, and then
Yep.
you still have to do B12, you still have to do vitamin D, you still have to do calcium.
It ends up being like, I want to say 6 or 7 different products that you would have to take.
That's right.
To get what would come in one of these and calcium.
Right.
So.
And again, that gets pricey. Now, can you go to Walmart and go to the grocery store and get those? Yes. What I will tell my patients is make sure whatever you're taking, it lines up with this. If you're not getting all this, you're not taking enough. and then I'm just going to end up prescribing you another pill to take or get you to go do an iron infusion or something like that. And so you also need vitamin D. And so at least 5,000 IUs of vitamin D. Vitamin D is super important.
Mm-hmm.
Vitamin D tells your body to kind of absorb the calcium from the food that you eat.
Yep.
So
Yes, exactly. I mean, it helps with immune health. I think we all learned that too during COVID.
Yep.
Vitamin D was a big thing. So yeah, so all of these vitamins have plenty of vitamin D. And then also when you take calcium, you do want a calcium that has vitamin D, again, to help with that absorption.
Exactly.
Have those together.
You need vitamin E, so you need 15 milligrams a day. You need vitamin A, so 5,000 to 10,000 IUs a day. If you are pregnant, they don't want you to go over 5,000 IUs. And I believe on all of these, the max that you'll get is 5,000. It doesn't go over. Well, even this one
And
is
I think it's
3,000.
the issue is the retinol, right?
Yes.
So we actually recommend this product, the multi-EA, for
Oh.
pregnancy.
Okay.
Because it has a blend of beta carotene and retinol, so it's going to decrease that concern in pregnancy.
Wonderful. Okay, so we'll
Yeah.
definitely talk about that because I have a bunch of ladies that are pregnant, and then I've literally gone through with them, so I didn't realize
Yeah.
it. This is
It's a
such
great
this is so good for me. Okay, perfect. Okay, and then you definitely need your iron, 45 to 60 milligrams a day. Badness can ensue. You can get your hair loss. You'll get anemic. You get tired. You can get changes in your skin. You can get rashes, changes in your nails. And so, and if a patient comes to me and they're having hair loss, I'm going to have some more videos on that. If they're having hair loss, it's your protein and iron every time. And when it comes to iron, sometimes it's not just you. You're either anemic for one or two reasons. You're either not getting enough in,
Right.
or you're losing it. So for some of my ladies, let's say they've had weight loss surgery, if they have really heavy cycles or erratic cycles or something like that, then them having weight loss surgery can unmask that borderline anemia, and then it's just badness ensues.
Yes, and you don't want to get to the point where you have to go in for an iron infusion. That's
No.
for sure.
No. You need zinc. So you need 8 to 22 milligrams of zinc a day. That's also good for if people are low in zinc. You can have changes in your hair, changes in your skin. Zinc is also really good for, warding off the cold.
Our immune health too. Yeah.
Yeah,
Very
it's important. And in copper is you need 1 to 2 milligrams a day. And I never can remember, isn't there a ratio like?
Yes.
I'm all putting her on
I
the
know,
spot. It's
I
okay.
know.
But it's like, it's one of
Yeah.
these things where if you have zinc, you have to have so much copper.
Right. And basically, you don't want to do high doses of zinc for a long, extended period of time with not enough copper.
Yes,
Yeah.
because it can kind of leach out of your system.
Right.
And so, and again, with copper, you can get an anemia. It can cause some neurologic defects as well. And what I find is with some of the over-the-counter vitamins, they might have some of the big ones like the B vitamins,
Right.
but they're always lacking in your magnesium. They're lacking in copper. They're lacking in zinc. And if you're a weight loss patient, whether it is surgery, certainly, or even if you're doing medical weight loss, you're going to be lacking those, and then you don't know why you feel like crap.
Well, and most of us don't get 100% of the recommended dietary allowance for vitamins through our food alone. So most of us, outside of surgery, I would say most of us need a multivitamin.
Yeah.
Because we're not able to get it from our food alone, typically.
No. So my recommendation, this is going to be part 1, and then we'll have another video for part 2. My recommendation is if you are a weight loss surgery patient, I really recommend that you get a good bariatric formulated vitamin because it is mucho important that you are meeting your vitamins every day. And it's not just for right after surgery. It's
lifelong.
lifelong.
Yeah.
Like if I cut off your stomach, that thing's not growing back. If rearrange your small bowel, it's not going to unrearrange itself unless
You're not going to eventually be able to just suddenly absorb everything.
exactly. Ooh, let
Like
me show them this
before.
picture. So she brought me this picture. Hang on one second. So for instance, ha ha ha! Look at this. Okay, so this kind of shows absorption of the nutrients. This is your esophagus, stomach, and small bowel. And The stomach and small bowel are going to be key for absorption, mainly your small bowel, but your stomach does aid with, clearly with digestion, but the majority of digestion, like the real workhorse, is really in that small bowel. That's why you have like 14, 15 feet of small bowel in your belly, okay? So what you will see is that,
Help you hold it.
yeah, so your stomach is really important for your iron absorption, because it is in your stomach where iron is converted to the more absorbable form. And ironically, you do need some acid for that conversion to happen. Now, this is where it gets tricky whenever you're a weight loss surgery patient. For the first 90 days, I have you on an acid blocker. So there's that. But then, if you think about it, if you're having a sleeve, I'm going to remove a large portion of that stomach. So you just have this narrow band. Then the majority of your acid producing cells are down here. When you have a bypass, the part of where the food is really mixing in the stomach, we're stapling and cutting off the upper portion of your stomach up here. So food, when it comes down this way, is not even interacting with anything really down here. And so that's part of the reason why when you've had weight loss surgery, you're a little bit more prone to anemia.
Yeah. Well, and I would say too with calcium. So calcium carbonate needs acid.
Yes.
So it's recommended that we do after surgery, do a calcium citrate versus a calcium carbonate.
Right. And so an example of a calcium carbonate would be like Tums. Yep.
Which was recommended, 20 years ago, before all these products came out?
Exactly. But calcium citrate is really what you need, because you can take it at any time. It does not have to be in the presence of acid. And so think about, like, if you have a patient or you come to see me and you're having horrible reflux, do you really want to go off your acid blocker just so you can take your calcium? No. You want to take your acid blocker so that you don't have the reflux. You just take you some calcium citrate. Yeah. And it's in the first portion of your small bowel, that's called your duodenum, where the majority of the absorption of your vitamins are going to take place. So like your calcium, your iron, copper, zinc, other micronutrients. You're still going to absorb all throughout your gut, but it's just that the majority of it happens with the first portion of the small bowel, which is why after a bypass or duodenal switch, you're a little bit more prone to vitamin deficiency, because where vitamins are usually absorbed, it's now happening further bit downstream. B12 actually is absorbed way down here at the bottom part of your small bowel. However, B12 needs a little carrier molecule called intrinsic factor. You'll know that whenever you're playing Trivial Pursuit. So it needs intrinsic factor, and that's what is mixed up here in the stomach. And then so that you can absorb it way downstream. So there's all these different things that need to happen so that you can reach your vitamin goals. And so if you've had weight loss surgery, clearly you'll have some changes in your anatomy that affect this. But I mean, even if you're doing a weight loss program, if you're in a calorie deficit, or let's say you're vegan, or you're I don't know, what are people like? You're vegetarian. You're not going to be taking in everything that you need, and so you have to make sure that you're supplementing with a really good high quality vitamin. Otherwise, you will think that your issues with hair or fatigue or skin or lethargy or confusion or lack of sleep or all of these different things, you're going to think it's because you're not getting enough calories. But in the end, it really just might be, it's nutritional.
Yeah. I mean, you're eating less.
Yeah.
And you're just not getting all the nutrients that you need from your food. There's less food there. So, yeah.
Exactly. So, the moral of the story is we really all probably need to be taking a good multivitamin every day. It is not uncommon for me to have a patient to come see me, and when they see me for the first time, they're iron deficient and they're vitamin D deficient.
Yeah. It's very common.
Yep.
Very common.
Yep. And that's because we have poor diet, and we also don't go out in the sun anymore. Right. So there you go.
That's it. And we put sunscreen on when we do go out in the sun, which is good. We need to.
I know. We don't want our wrinkles.
No.
Nope. All right, you guys. So I'm going to have this linked with all these different recommendations. This will be part 1 of our vitamin series, and stay tuned for part 2 because I want to talk about some specific multivitamins just for you guys. Okay.